You have been scheduled to lead along with an LRT/CTRS, aquatic therapy, and a psychiatric unit. You're in week 8 of your internship. You have 6 patients scheduled to attend and are dressed and ready in the day room 10 minutes prior to the session. You have checked the patient's chart and they all have appropriate orders to attend. What should you do next? Think about the APIE process. The assessments are complete. What should you go over with your patients prior to the start of the session?
So prior to the start of the session, since we've already done the assessment process, which is the A and the API process, the next step would be the plan. So you would go over with all of the patients or participants the safety procedures and also the plan of care.
Awesome. Scenario number 2. Your 6 patients are ages 18 male, 27 female, 54 female, 60 male, 33 female, and 43 female. You've worked with the 18-year-old male for 2.5 weeks prior to this session. He has a limited support system at home. You've built a strong rapport with this 18-year-old male by this point. In aquatic therapy, the 18-year-old male discloses to you that he is discharging in the next 2 days. You congratulate him. He then asks if you want to hang out, being friendly, or is he coming on to you? It doesn't matter who you take the question. Once he is discharged, how should you proceed?
So in this situation, you want to handle it delicately because you don't want to insult the patient, but I would definitely want to set the boundaries that I'm the therapist, they're the patient, and that if they ever need to come back to the facility, if they need anything, to let them know that they can definitely come back, but it would not be appropriate to have a romantic relationship outside of this facility or inside this facility. If he doesn't have a good support system at home, I would try and look into maybe getting him like an appropriate mentor that he could go to even after therapy with us.
Awesome. And then last one, number 3. You are in week 4 of your internship and are observing a session. A rehab patient starts to seize. What should you do as an intern?
So as an intern, we are required to be CPR and first aid trained, and when someone is having a seizure, you need to, as an intern, I would obviously try and get someone that was above me if they are around, but another thing that I would do is make sure that nothing is around the person, that they are turned on their side so they don't choke on their tongue, and also there's nothing that can hurt themselves, and you never want to try and hold them down. You just have to let the seizure happen and make sure they're safe, and also you should time the seizure to see how long it lasts.
Good job. You're all done.